Session, I want us to examine the Weiner RH HR terminology. All right. So, Weiner is also instrumental in giving us the idea as to how the RH can be classified. We have previously discussed the Fisher and Race terminology, which is the DCE terminology, and we came and established that big D exists in the presence of, but the small d does not exist in the terminology. All right, so if there is no big D, it means that D is absent. And we also came to the realization that DCE, we have capital D, capital C, capital E, and we have common C, common E. If the person has capital D, we don't expect them to have common D as well. If the person have capital C, we don't expect them to have common C. If the person have capital E, we don't expect them to have common E. If the person doesn't have capital D, we expect them to have no D. All right. If a person has doesn't have the capital C, we expect them to have common C or lowercase c. If the person does not have a capital E, we expect them to have common E. So when we have wrapped our minds around that, we are able to appreciate the Fisher race haplotype terminology. And one more thing that I want us to rivet in our minds is that the nomenclature is DCE. So if we are doing the breakdown and we have a misfit, we have to put it back in that order. All right. So with that said, we are now positioned to go and explore the Weiner terminology. So when we talk about Weiner, we're not talking about that kind of Weiner. We're talking about the Weiner in terms of the person who discovered this classification. All right. So it was in the early work that defined the Rh antigen. So Weiner believed that there was one gene responsible for defining the Rh that produced the agglutinogen containing the Rh factor. All right. So the agglutinogen may be considered the phenotypic expression of the haplotype. So when we are listening to Weiner's position on the Rh, we are seeing where his mind was when he was proposing this discovery. So in his proposition, each factor is an antigen recognized by an antibody. The original Weiner nomenclature named 5 common Rh antigens. So we have the Rh null or Rh0. We have those are capital R, common H, and subscript 0. Then we have lowercase r, lowercase h, and superscript dash or 1, whichever. And then we have lowercase r, lowercase h, and 2 superscript. All right, and then we do the reverse. Instead of having RH, we have HR with the 1 superscript and the HR2 superscript. All right, so with that understanding, we can understand and appreciate where his mind was going. But these terms are no longer used in favor of a modern form of the Weiner nomenclature. And the modern form is what we are going to be getting into. Let us see if, let me pull the tablet so we can just put on the screen the nomenclature that we had in the past. I know that sometimes it is better for us to have a visual representation of what it is that we are saying or we are suggesting so that everybody can have an appreciation as to what is actually taking place. All right. So let us get this on screen. So this is the previous nomenclature. And as we said before, we had R, capital R, H, O. That was one. Then we had lowercase r, we had H, and we had a superscript. Then we had R, H, and we had 2. That's another superscript. But then we also had another type, and it is the reverse or the inverse of this nomenclature. So you're going to have HR superscript, and then you have HR double superscript. All right. So these were the olden nomenclature that were utilized. And if we have an understanding of this, then we are properly positioned. As we get further down, we'll understand what is the significance of all of these. All right, beautiful. So, in the modern modification of the RH nomenclature, an agglutinogen is used to describe or is described by a letter and a symbol assigned on the factor being present or absent. All right. So when we have uppercase R, that denotes the presence of the D antigen. When we have the uppercase R, there is the presence of the D antigen. So the lowercase r indicates the absence of the D antigen. So we have the uppercase, the presence of, the lowercase, the absence of the particular antigen. All right. So we have covered what D is. Now, let us look at it. So D is denoted by R. Now, the presence of C antigen is indicated by 1 or the prime. All right. So when you saw us having the prime, that there was what we were basically denoting. So the C antigen indicated by 1 or a single prime indicates the presence of the big C. The C antigen, the lowercase c, is implicated or implied when there is no 1 or prime indicated in the nomenclature. All right, so we get the C, the D. So now we need to get the E. The E antigen is indicated by the number 2 or a double prime. And that is the big E, all right? And the E antigen, which is a lowercase, is implied by the absence of the 2 or the prime. So I know that this may be a little bit tricky to understand, but if we jot it down, then we may be able to wrap our minds around it visually. All right, so let us go back for the tablet and try to put this into perspective. So we have the D antigen, and the D is represented by R. So D is denoted by R. All right. So if R is present, then we know that there is a D. If there is no D, then the R is not going to be capital, all right? The R is going to be lowercase, which means that D is not present. Good. I would have written D, but we know that there is no such thing as a lowercase d, as we discussed from the Fisher race terminology previously. All right, so let us just have that as a reference. Right now, we know that the Fisher race is D, C, and E. Those are the three that we focus on. So now R is the indicating D, lowercase r indicating the absence of D. So let us go to C. What could give us the C? Now, big C. We have big C when we have 1 or a prime. So if we have 1 or prime, we know that that is big C. In the absence of it, we have the little c. All right? Now, let us move into E. When we have E, we are thinking of having 2 or double prime. If in the absence of this, guess what we have? We have little e, just like that. All right? So with that in mind, we have an appreciation as to what is taking place. Now, I want us to position ourselves to appreciate the dynamics of this nomenclature. We need to understand the RH blood group system. We need to understand the nomenclature, especially when we're doing special blood bank immunohematology testing and classification, when we're doing the phenotyping and genotyping methodologies. These will come in handy, all right? So they may seem somewhat abstract in this moment, but if you're working at a reference facility and you have a challenge a patient to find compatible blood and blood products, you realize that this terminology may be of benefit for you to understand and appreciate. Now, let us try to wrap our minds around some examples. So, if we have a situation where, let me go back for the tablet, where we have R1, this is indicating to us that the big R indicate that D is present. The 1 is indicating that what is present in 1? What is the second thing? We have D, C, E. All right? That is what we have. This is R. Number C is 1 and E is 2. Or we have prime or double prime. So use that now to put things into perspective. So when we have big R and 1, it tells us that we have D and we also have C. All right? So that there is something that we should bear in mind. So now that we have that down, we are now positioned to understand that D is there, C is there, but we don't have any indication that E is there. So what we're going to do, we're going to put small e. I know that you may be saying, it's that simple. Yes, it is actually that simple when you understand the concept. But let us do another notation. So we have lowercase r and we have a prime. All right. So when we have lowercase r and we have a prime, This is telling us that D is not there. So D is not there. So we can't have D in the equation. Prime. The prime is indicating that C is there. All right? And D is not there. So if C is there, D is not there, and we have no indication of anything else, then this should be CE. All right? So let us just clean this up and just put it how it would appear. It would be CE. Just like that. Now, let us do another. We have big R and we have 0. What would this indicate? The big D, big R indicate that D is there. So we have D, but we have 0. 0, we never saw 0 before. This 0, we didn't hear about 0. We know that if there's 1, C is there. If there's no 1, then there is no C. Big C. If there's 2, there is E. And if there is... So could this mean that there is no big C and no big E? Could this be what R0 means? And actually, that is exactly what it means. So once you have this terminology in your mind, then you can appreciate exactly what is taking place. All right. So the presence of E is indicated by the number 2 or double prime. So if there is an E, we're going to have the number 2, that's it, or double prime. And you may realize that when we are using the uppercase nomenclature, or we use the R, the big R, we normally use the number. And when we use a lowercase, we normally use a prime. That is just based on preference and for ease of understanding. All right, so lowercase e is implied when there is no 2 or double prime. So let us do another example. If we have R2, this is indicating to us the big R indicate that there is D. The 2 indicate that there is big E. But we don't have any indication that there is a C. So we're going to put the small c. And that there is how simple it is. I know that many persons find it a little bit challenging, because when I was a student, it was a bit difficult for me to understand the concept. However, with time, I developed my strategy in preparing for my examinations. And with that strategy, I was able to SWOT or memorize just for the examination so that I could put it on the paper. But I don't want you to just memorize or SWOT the nomenclature. I want you to have an understanding so that if you see it in any form whatsoever, you are able to decipher it and to determine what is truly happening. All right, so let us see if we can do another. If we had a R and a double prime, this would denote to us the lowercase r indicate that there is no D, there's no big D, and we know that there's no small c, so we're not going to put that back right now. All right, but there is a double prime, which means then that 2 would be activated if there was a big R, but because it's a small r, we use a prime. So this 2 is indicating that there is a E, big E, that is present. And we don't see any notation for the C, the big C, so we're going to put a small c. So this here would give us C, lowercase c, and big case E. But what if you just had an R? An R would indicate that there is no D present. We don't see an indication for big D, and we don't see any indication for a big C, and we don't see any indication for a big E, which means that this here would tell us that we are looking at lowercase c, lowercase e, just like that. Now, when both C and E are present, we use the letter Z or Y. So when big C, Z is used when there is big C and big E. All right? So if we had something like RZ, what is this denoting to us? It would denote to us that big R indicate D. So we know that there is a D. Z indicate that there is C and E. And just like that, DCE. Now, let us do one more, so that we can have a little idea as to some variation. What if we had a situation where we had R, lowercase r, and Y? So the lowercase r mean that there is no big D. So let us put it, no big D is there. The Y indicate, remember Z or Y indicate that there is, what does Z or Y indicate? There is big C or big E. So C and E. So this here, let's clean this up, would be C and E, just like that. So that there is just an idea as to what is possible with the DCE nomenclature, and we can wrap it together and integrate it into the Fisher race nomenclature and map it out into the Weiner nomenclature. All right. So some other things that I want you to be aware of is that phenotypes of less common Rh types, such as Rh null and Rh mod, are present. So for the Rh null, you will have Rh and null super subscript. And for the Rh mod, you will have Rh and mod subscript. All right, the genotype of the Rh null that arise from a morphic gene at both Rh loci is written as R, lowercase r with double tilde or double bars at the top of it. All right, so a little r with double bars. So that there is just something that I want you to understand and appreciate. And we can get into some designation after this, so that you can see how things are mapped into place, so that you can appreciate the idea that exists with this terminology. So what I'm going to do, I'm going to leave on screen some nomenclature that you may find helpful in mapping, but you would have gotten the full understanding as to how to deduce the Weiner nomenclature and how to map it to the Fisher race nomenclature. So this here is a simple methodology. You can use this sheet if you want, but based on what we have discussed and based on what we have imparted, you should be in a position where you actually don't need a sheet. But just in case you need a sheet, I'm going to leave this sheet on screen so that you can use it to map as is necessary. So now let us just do a quick recap. When we have R, it indicates to us that the big R, capital R, indicate that the antigen is present, which means that the person would be Rh positive. When we have a lowercase r, the antigen is absent, which would indicate that the person is Rh negative. If we have 1 or prime, that means that big C is present. If we have 2 or prime, that means that E antigen is present. That's a big E antigen is present. When we have no prime, it means that no big C is there, so the little c antigen is implied. When we have no double prime or no 2, then we have the small or lowercase e antigen being implicated. If we have Z or Y, we have both C and E, that's the capital C and capital E antigen being present. So with that, we can map everything in accordance to what they are. All right. So I hope that this was helpful for you to understand and to appreciate the Weiner nomenclature as it relates to the RH blood group system. After this session, maybe we'll have a brief quiz so that you can see if you have gotten the concept, but that is to be determined. But until then, this is your professor signing out. Have yourself a great day.